In this video, I'm going to show you how Primary Care Online integrates with Engage Consult, which is a digital-first consultation provider. This is part of a series of videos done with Primary Care Online and has real potential impact in terms of the flow of patients through your practice. Shall we take a look?
So we talked about the website accessibility and also the support you provide through care navigation. What else do you guys do?
Our partners in primary care also use a lot of other providers, such as triage providers or text message providers. So we partnered with Engage Consult to their speciality is workflow management and integration into clinical systems, all three clinical systems, those being EMIS, Vision and System 1, with new care providers coming on all the time, and they will also integrate with those care providers or clinical systems when they do become available. So we've partnered with Engage Health, Engage Consult. So we've got two platforms really to help practices allow patients to submit clinical and non-clinical requests through their practice website, and for those requests to go into a workflow management system with then clinical integration. So if I share my screen, and by the way, if practices do have other providers, when we do build the request an urgent or request a non-urgent, we can embed the link to the provider in any of these forms. So they don't have to have our forms. They can just have instructions for the patient about how to book an appointment, and then maybe a link to that provider, and there are many out there. But if they wanted us to build the forms for them, all our forms will then land into the Engage platform through our secured API. And you can see here that we've got a few submissions for a non-urgent routine appointment. So let's go to this. So I submitted one earlier this morning. So from the website, I submitted a request for a non-urgent routine appointment using this form. This then lands securely into the workflow management system. And you can see now, this is the dashboard where you can see we've got all staff here, we've got all submissions, we've got 2. And let's take a look at this request. So that it's got the patient's details here, and the request has come in. And we've done a bit of work on this because it's a test patient. You can see that this is what would come in. So this is the question, what is the main issue you need help with? And this, again, we can build fully customizable forms so that you can customize the way of the questions they want. A lot of our surgeries, when they asked us to build this, they're kind of constrained by the questions being available by their current triage provider, whereas with our forms, it's fully customizable. So we can build a form around whatever questions you want asked. So okay. Yeah, the patient can fill it out. They fill out with the details that you've requested. They can also upload an image if you want them to upload that. We can prioritize this as urgent, same-day routine. So let's prioritize this as urgent. You don't have to put a reason why it's urgent. And when you go back, so it's just a bit slowing. When you go back, you can say, okay, well, I want to view this as priority first, so urgent would always come on top. Let's go back into its request. You can see that it's got the requested details here, and the patient's been verified. So we do link to the spine system. So when patients do come in, you have to verify them the first time and link that back to your EMIS, Vision or System 1 system. Once it's verified, you're not going to do that again. You can see the requested details here. You can see any notes that's been put on there. You can add a note yourself. Any messages between the surgery and the patient. Again, we've done some test messages here. And any attachments the patient sent. So in this case, the patient sent an image. So you can contact the patient either by a message or a video consultation. So let's send a message to the patient. Now, to cut down on costs, you can message the patient by email or SMS. So for this, let's select email, and you can select from a template. So you've got, again, you can build organizational template messages. So let's say this is a non-urgent appointment request. Again, you can build that. You can add an attachment if you wanted to. You can allow the patient to reply once. So, for example, if a patient sent a request in, and the GP thinks, "Oh, I actually need a photo for this." Let's if it's a sore throat, for example, you can allow the patient to respond by sending an image of a sore throat. But in this case, it's just telling the patient to book you're allowing, so that you would not allow the patient to respond to that. It's just a one-way message sent by email. You can send that message, and that will go through to the patient. And again, there's no cost to send that request because it's gone by email. So now you can see the message has been sent, and there we are. That's the message. You can build your organizational message from here. But if you wanted to allow the patient to respond once, for example, to request more information, you can say, okay, yes, request, and then say, yeah, allow the patient to respond once. That will send a message again by email, so there's no cost for email, and the patient can respond to that message. You wanted to send by SMS, that's a separate system, but you can do it from within here. That'll go through as an SMS text. That does attract a carrier charge of, I think it's not 2 pence. So you can send that again. You can allow the patient to reply once or not at all. So let's cancel that request. Sorry, let's cancel that. And then when you go to complete, you can assign. You can add a note to somebody. So let's add a note to this. You can again select a template from your. So let's say we can send this to the admin team, and you can assign that then to a colleague or to a group of staff within. So you've got, again, we build all this for you in the background before it goes live. If you want to send that to the doctors group, that's fine. You can add the note and it'll go to the doctors group then when that's done, and it'll go to the team then. And once you're, if I'm in the doctors group, I can see that that's come through to me now. Once you completed it, you can say, okay, action, I want to complete. You can just send to clinical, or I want to complete this. Yes, please attach to clinical, and it'll attach to EMIS Vision or System 1. And you can put whatever you want in here, and you can choose what you want to code. Yes, I want to code what the patient's query was. No, I don't need to code all these messages. You can untick whatever you want, and then send to clinical. That will now send to clinical system. It does take a bit of time. There you go. That's done. And then you can complete complete with whatever you've done, and then message, or you can do the outcome face to face. The outcome is optional, but let's just complete that, and that's done. And now it's off the complete. Now when I go back to here, you can see that request is gone and it's now in the completed file. So it's really a complete workflow system for the patient. You can also create a request on behalf of the patient. So is the patient yes? You can put the name. So go for Mouse and Mini. You can load from the patient within EMIS Vision, or you can just find the patient. Okay, sorry, I've logged. EMIS has logged me out. Let's just go back in. Let's get the API connected. But you can find the patient from here and create the request. And again, we've done one earlier. This is a request created on behalf of the patient. And again, you can so priorities matched. Again, we can do it the same day. Again, you can contact the patient from whatever you in the same process. If you create a request on behalf of the patient, you can message via email or SMS. There's a dashboard there to tell you how many requests are coming in, what it's been allocated to. Let's go back to dashboard. You can go into Management Console and you can build. Again, you've got care navigation. So if you want to say, okay, well, all admin requests should go to the admin team. All medical requests should go to the doctor's team. Whatever way you work, if you've got a care navigator looking after all these requests, or if you've got a GP, they're triaging everything, you can care navigate the forms to automatically go or to come into your organizational settings. And again, you can set up templates. So if you do want templates, you can set up an admin team template. You can even add attachments to that template, and you can even assign it to individuals or to a team. So we can but again, we build all this for you before you go live. So it's not a lot of work for PMs to do. We'll build the whole system for you. And again, if you just wanted to complete this now and say, okay, complete, and you go to complete, and yes, you can say just complete without attaching, because you may not want to attach everything to clinical. When you do attach to clinical, it's saved as structured patient data, not a PDF, because PDFs are quite difficult to view in EMIS and Vision System 1. It goes back in as structured patient data as if a GP or as if you've done that as a consultation.
Okay, so this uses the Engage Health Consult platform to support the practices along with the forms that you yourself have created as part of the Primary Care Online platform. Is that correct?
Yeah. So they've got two options really. We can either use our form builder, or they can have the entire Engage platform where we just link to the Engage platform. This is one of our surgeries in Llansamlet, where they preferred not to have the form. They preferred to have the full system, where the patient can click on how to make an appointment, and it brings up this Engage platform once they've read the other access guidelines really, and the patient can have a login, so they can create an account using NHS login, and they can submit an inquiry then through the NHS the Engage portal. So they've got two different systems really. It's entirely up to the practice which system they prefer to use. A lot of practices say, no, I don't want that. I just want the patient to fill out a form, and then but any way they do it, either by just filling out the form or clicking on the Engage platform, creating an account, and then submitting a system here where the staff can manage the workflow quite easily from this system here.
Okay, and that will also work with other online consultation providers as well in terms of the Primary Care Online forms integrating with other systems.
Yeah, so it doesn't matter which supplier you have. So if you've got a clinical integration with System 1, EMIS PCS, or EMIS X, I think is coming out, or Vision. If you change, I mean, all the practices in Wales are now moving from Vision to EMIS. When they do, we'll just change them from Vision and to EMIS. It doesn't matter which provider you're with. We do that in the background for you. There's no work for the practice to do constant on the practice website.
And I think you've also got other platforms that people can use it if they wanted to just stick with text messaging only, if I remember rightly.
Yeah, so text messaging, if they don't want to use a sort of triage, and by the way, fill out the form, it doesn't have to go to a triage provider. The forms can just go to the email address within the practice, so they don't have to pay extra for, if they just want the website and the forms to be built, we'll build the forms for them. They say, no, we're happy to receive these in practice. Then they can just have that into a dedicated email address. When we build the forms, we can build the forms to code to go to anywhere. So if I build a form, and if the Engage system is not built in, we can put in a destination email address. So referrals can go to the secretary, or it can go to different email addresses. So if a surgery doesn't want triage and they only want messaging, then we have a standalone messaging system, which is outbound, which is they'll see this. So they can have the website with us only, or they can say, okay, well, I'd like the website, but I also like messaging. So again, we link with Engage with a standalone messaging system without any workflow. So they can create a message. And again, to cut down on costs, they've got the option of doing SMS only, which, bear in mind, that does, for any provider, that will attract a carrier charge. But they can say, okay, well, I only want then to do email. I want to do an email campaign. So you can email the patient cleverly loaded in EMIS, or you can find the patient, or you can say, okay, I want to send an email campaign to multiple patients. You can go into Informatica or EMIS or Vision and download a CSV file of a cohort of patients, upload that CSV file, and you can send that out there. But let's say they wanted to send an SMS, exactly the same, load the patient currently in EMIS, or I need to find a patient. So let's find Mouse and Minnie. Let's find that patient. Hopefully it does find them. Yeah, there we are. So there, and then they can go through the process of loading that patient and sending it. So they can load it from within Vision or EMIS, or they can find the patient, mobile number in. This patient doesn't have a mobile, but let's just, and then select a template. They can select the template of the messages. Message templates they've already built. or they can free text if they wanted to. They can upload an attachment. They can allow the patient to respond once or not, and they can send immediately or schedule if it is a bulk campaign. But it's really important, I think, to note that this is a standalone messaging system, which allows SMS. But if they want to save on costs, because SMS can get out of hand sometimes with text messaging costs, then they can choose to email or SMS.
Definitely agree with that, particularly when you look at the fragment costs versus
we've just been a bit vigilant with that.
Yeah, cool. So we've talked.
So our fragments are built with 160 characters or less. Sorry. So each fragment is built with 160 characters or less. So it does cut down to one fragment to cut down the costs. But again, just bear in mind there is an option there to email to cut down costs completely.
Thank you, Steph. So I guess a few other questions that come to mind when we look at various different systems and stuff. So if people were interested in looking at primary care online and using the platform that you've got and stuff, what's the typical, I guess, onboarding time that they would have to think about? You know, what can they expect when they're contacting yourselves?
Yeah, so we'd always ask them to have a Teams meeting. So if you wanted to build a practice website, for example, we'd have a Teams meeting with the practice, either in person or on Teams. Or we'd like to find out what they want in their practice website, how they work as a practice. Everybody works differently. And then after that initial meeting, we'll go away. As I said, there's no charge for the build. We can build free of charge. And we'll go away and we'll build the website. That usually takes about 4 days. And then we'll send an offline copy back to the team for them to view it. There's unlimited update requests or revisions until they go live. But generally speaking, between them making an initial contact, the fastest we can probably get it out the door when the website is 7 working days. Bearing in mind that if the practice wants to retain their current URL, there's a 24-hour transfer period for that, but we would work with their current provider to retain that. If they want a new URL, that can take 24 to 48 hours to obtain from DHW or NHS Digital England. So we'd say for a website is about 7 working days from initial contact to them then going live. For the Engage platform, we ask for a 2-week process for us to build the system, and during that time where we build the Engage workflow platform for you, where we train your staff internally also during that 2-week period. We do have online modules, but we'd like to train them in a meeting like this, or they can access the videos. It's pretty self-explanatory, but we need to ensure that training is completely before they go live. So for websites, we'd say 7 working days for Engage system, to 14 working days or a 2-week period between initial contact to go live. Again, for the messaging, we'd ask for that 2-week period so we can get that clinical integration with your clinical provider to make sure that integration is working properly.
Okay. And
for the care navigation AI tool, again, we'd have a meeting with the surgery to find out the data they want. We build the sitemap, but then also link to other services within the health board or the authority, and then send that back again for testing before making live on the website.
So what kind of time frame would you talk about for the care navigation tool?
Yeah, again, as the website, about a 7 working day turnaround.
Okay. And you mentioned that obviously this works no matter which clinical system you're using. So EMIS, System 1, Vision, potentially the newer entrants once we know how they're progressing and stuff. We know you've got that deeper level of integration with Engage Consult as well. How does it work with other, I guess, online consultation providers? Do you work as effectively?
Yeah, so surgery are free to choose whoever they want to go with. So if they have another provider, we work with them, and we work with the practice to ensure that the provider's links are embedded within the website. We've got a lot of surgeries who use another provider, and we put a quick link on the homepage to access that service. Also put it on the practice's how to make an appointment page, so it does answer the access guidelines. We try and work with the practice as much as possible to make that as accessible as possible for the patients to quickly access that service without having to search the website to find it. Some surgeries use it as a total triage. Some surgeries use other triage providers as just admin forms or non-urgent requests. However they want to use that service provider, we work that out with them in the discovery call, and then build the website around that service that they want.
Okay. And if practices were looking at these platforms, what would their be anticipated costs be, say, for example, for a 10,000 patient practice?
It's the same. So it's the same cost for everybody. So when I was PM, we used a triage provider, but only 45% uptake we had for our clinical triage provider, and they were charging us pence per patient. So we charge a flat fee, doesn't matter how many patients you've got. I didn't like the pence per patient charge. So on our website, you'll note that website pricing plan and the premium pricing plan. We've then got the pricing for the AI navigation bot. The triage forms are completely free. We can build unlimited triage forms for you, clinical or non-clinical. There's no extra cost for those, and they can go into your dedicated email address within the practice. If you did want the workflow engage system, then that's £2,550 per annum, no matter how many patients you have registered. And for the text messaging system, we don't charge on patients registered. It's a flat fee of a £450 license annually, but then obviously there's the carrier charge per text, which is priced at 0.02 pence. But we moved away from the patients registered and just gave a flat fee, so the surgeries can sort of build their budget for the year, know exactly what they're going to be paying. For EMIS practices, we do also have self-book. Unfortunately, that has to be priced at registered patients, so that's the price of 19 pence per registered patient for the self-book links. That's for EMIS practices, and System 1, that's not available for Vision, unfortunately. They don't offer that. But we prefer to price it on a license per year and not based on your pence per patient. And when you do visit our website, when you go to solutions on there, as much as possible, you'll see my ugly mug, but it'll be there to help surgeries to find out what we offer. It's not just a page where we tell you what we offer. The video is there to tell patients, to tell surgeries what we do offer in a video format. We find that works better.
So you mentioned something on there as well about AI video guides. Can you tell us a little bit more about that, Steph?
Yeah, of course. So AI videos are it's a really good way to communicate your services more effectively to patients. So I'm going to share my screen now and go to one of our surgeries who really, we built this from last week. So this is Blackwood Medical Group. And we worked with them to ascertain really how they work as a practice. So their appointment system is not complicated, but they wanted to communicate their appointment system as much as possible to patients. So instead of having a really long page where there's lots of reading and patients may get bored of reading that information, we've broken it up into sections. So this text we've uploaded to our AI software, which has then produced an AI video. They've chosen their avatar and they've chosen their chosen accent. Patients can click on this video and it communicates to patients everything that's in this text here. And we've put quite a lot of videos up here. So how to make an appointment, how to make a routine appointment, same day appointments, clinical pharmacy team. So patients can click on the video and it interacts more with the patient. So we hope that in the hope that they do retain more information and a better understanding of the process offered by the surgery. It's just another way of communicating the service to the patient, really, without them having to read quite a lot of information which surgeries have to put on their website. They can watch the short video. Everything is kept under 2 minutes because patients tend to switch off after 2 minutes. So it's a short video to inform the patients, how and really capture the patient's engagement.
I can definitely see how that'd be really useful for practices in terms of being able to create your individual video-based information for your patients. And I love the fact that you can customize it not only based off the words and the text, so the information's correct, but also the accents. That was quite cool. So I really like that and stuff. Cool. And I guess if people wanted to find out more, I guess the best place for them to go is going to be primarycareonline.io.
Yeah, they can visit our website here. So when they go to the homepage, everything is on the homepage, or they can click on solutions, and they can contact us, or they can book a free demo. When they click on demo, they can book a team session with one of our team. They can contact us. When they scroll, they can we've got everything. They can click on all our services. It'll take them to more information about what we're offering to find out more, and they can get in touch either by phone. We've got links to Facebook, X, or they can book a demo with us directly. And of course, we've got a bot built into our practice website, so they can look to find what they're looking for using the bot as well.
Cool. Thank you, Steph, for taking the time to show us around Primary Care Online and what you can do. So many different services built into there. And I like the fact that, like you say, you've moved away from that pence per patient amount, because that does potentially help practices streamline how they're going to manage their budgets, as well as understanding what they get and don't get and stuff and things from there. If people do want to check out more, I'll put the links down below so people can access all of those as ever. And as always, on EGP Lane, we're here to help tech enhance your primary care and learning. Thank you very much for your time, and definitely check out more of that content.
If you want to check out more information about Primary Care Online, expand on the links down below on this YouTube video and have a look from there. Alternately, search for Primary Care Online. And that is how Primary Care Online with Engage Consult can help patients in your practice. If you want to find out more about how Primary Care Online can help with your website for your practice, check out this video here. Alternately, if you want to see how that they can actually help with care navigation through your practice team, including bots and stuff, then check out this video right here.